The pandemic has brought loss for too many families. And earlier this winter, it seemed like the news was just kept on getting worse here in Alberta. It was tough on all Albertans. It was tough on our health system. It was tough on our government as we struggled every day with the balance between protecting lives and livelihoods. But things have changed, more than I think any of us could have guessed, even a few weeks ago. The news is getting better today, just as fast as it got worse a couple months ago. Just today we heard that a fourth vaccine has been approved, this one from Johnson & Johnson. Now, we don't yet have a schedule for supply from the federal government in Ottawa, but we do know that even with the three current vaccines that have been approved previously by Health Canada, every Albertan who is an adult should be able to get a first dose by the end of June, as I said yesterday. And this isn't just a light at the end of the tunnel, it's the other side, and we're going to be there this summer. Now, of course, there's no guarantee, and I can't put an exact date on it. And there's still a lot of hard work for us to get from here to there. For the staff in our ICUs and other units in our hospitals who are still treating COVID patients, for the people doing thousands of vaccinations every day, and for all of us in sticking with the restrictions to make sure that we put COVID behind us. But for all of that, the picture has changed. So today I want to thank every Albertan working on the front lines, from the hospitals and the continuing care facilities to grocery stores and beyond. And now I want to talk about the promise that we made Albertans before COVID. We promised better access to our publicly funded healthcare system, starting with shorter wait times for surgery. We said that every Albertan should get their surgery within what doctors call clinically acceptable lengths of time. Doctors have agreed on what the targets should be, but no province has ever met them. Not for all patients. But I'm here today to say that we are sticking with our promise, that every Albertan will get their surgery within the agreed target by 2023. Now, this is a big challenge for us, made much bigger by the pandemic. And last spring, the health system was forced to postpone many scheduled surgeries to free up capacity for COVID patients. And the second wave forced postponements again in the fall and the winter. But this time we were better prepared to manage the demand on the hospitals and to reduce the disruption of scheduled surgeries throughout Alberta. So even as AHS was forced to make specific changes to free up capacity, they pressed ahead where they could. And they've worked in partnership with Covenant Health and chartered surgical facilities to minimize delays for patients and the backlog of postponed surgeries. Now, with Budget 21, we're committing funding to eliminate the pandemic backlog and ramp up further to reduce wait times. We're working toward the goal of treating every patient within as I said, what doctors call a clinically acceptable wait time by 2023. Through increases in operating as well as capital funding, our health system will provide more than 55,000 additional surgeries in the next fiscal year starting April 1st. That's on top of the normal volume of about 290,000 surgeries that will be done this year. The work has already started, with more surgeries being done in chartered surgical facilities and in specialized AHS and Covenant hospital units. And our partners in chartered surgical facilities began offering more surgeries to Albertans in December, and we'll be ramping up those efforts in the coming months. More than 40 of these facilities already provide publicly funded surgeries under contract with AHS at no cost to the patient. These facilities have capacity in their operating rooms and can easily and safely offer more surgeries like cataract removals to reduce wait times. In fact, in December alone, chartered surgical facilities performed 40% more cataract surgeries than they did the previous December. And we're also reaching out for new chartered surgical facilities, or those that aren't currently under contract with AHS. AHS will post requests for proposals this spring to move forward with this work. And by 2023, this plan means that chartered surgical facilities will offer Albertans 90,000 surgeries each year, far more than the current 40,000 surgeries each year. And for its part, HS has worked with Covenant Health to create 5 specialized hospital units around the province dedicated to surgical patients. And starting in January, these sites began ramping up to serve patients who need more complex inpatient or another way of describing it as overnight surgeries. These units are in Banff, Edson, Peace River, Innisfail, and at Edmonton's Royal Alexandra Hospital as well. Now, going forward, these sites will do more surgeries on weekends and evenings. Other hospitals across the province will also offer more surgeries depending on their COVID situation. But by allowing these 5 sites to focus on scheduled surgeries right now, we're reducing future postponements and decreasing the impact that COVID might have on patients. And we know that this may be hard for some families and patients to consider going to another community for surgery. We ask for your patience. We ask for your understanding. We don't want another spring slowdown where we have to postpone more scheduled surgeries, leading to delays in care for thousands of Albertans. This is a Made in Alberta plan, the most aggressive of its kind in Canada. And it ensures that we have the beds, it ensures that we have the hospitals, and it ensures that we have the staff to look after COVID patients. At the same time, it provides more than 55,000 additional surgeries for a total in the next year of 345,000 surgeries this next year alone to patients as quickly as possible.